Hello and welcome to Northeast Now. We are here at the Tibetan Medical Clinic in Guwahati, a branch of globally respected Men-Tsee-Khang Tibetan Medical and Astrological Institute. With us today we have Dr. Tenzin Gelek, one of the most respected physicians at the clinic, known for his compassion, deep knowledge of medical field and patient-centered care. Dr. Gelek has helped several individuals to revive and find relief through traditional Tibetan medicine. Welcome, sir, to Northeast Now.
Thank you so much.
In a world ruled by modern science and surgeries, medicines, expensive treatments, there exists a quiet place like this clinic. So, where medicine is not just taken, it is felt and understood.
Yes.
So, we would like to understand what is Tibetan medicine first of all from you.
So first of all, thank you very much for Notice Now for having me here. And yes, regarding your question, actually Tibetan medicine is all about balance. So Tibetan medicine is made of herbs, and I mean like Tibetan medicine is all about balance, because in Tibetan medicine we talk about the balance of three energies.
Yeah.
In Ayurveda, we also call this like Vat, Pitta, Kapha, three energies. And in Tibetan, we call Lung, Tipa, Peken.
Okay.
And also, so these three energies we have to balance to have a healthy life.
Okay, so it's like bile something.
Yes,
three
it's
energies,
bile,
right?
yeah, bean, bile, phlegm, something like that.
Okay,
And
yeah.
we loosely translate in English like that.
Okay, yeah.
But I like more to focus on the Tibetan term itself, because it has more detailed meanings. And another thing is we are made of 5 elements. So Tibetan medicine mainly balance also these 5 elements, from the external 5 elements to internal elements. So Tibetan medicine is mainly about mental physical conditions for which we try to balance through not only the medicines, but it is also very much related with psychosomatic issues, for which we give medicine as well as kind of guidance, like that. Yeah.
Okay, so psychosomatic diseases, can you explain a bit?
Psychosomatic diseases means like in this world, especially in the modern world, we say that everything is very much developed, advanced,
technologically advanced,
materialistically or whatever. No, but if you think realistically, we have more kind of mental crisis as the time advanced in materialistic way. So that's why I mean like psychosomatic issue means mental and physical problems.
Okay.
Especially young generations nowadays more have like mental
anxiety,
stress, anxiety, all these things. So all these things actually comes under wind energy disorders in Tibetan medical term. So this is in Ayurveda also we call Vayu energy disorder. So all this kind of stress, anxiety, depression, all this comes under the lung disorder. So lung is in Tibetan medical term is called, loosely translate like wind energy.
Okay, wind energy.
So everything comes under this. So modern world has more kind of mental stress, mental issues. For that, Tibetan medicine focus more, and it's really very effective. Because I do consultation not only here in India, but sometimes I also officially go for other countries, for 3 months, like that,
Okay.
So we can vividly see that so many has mentally crisis.
Yeah.
More than the technical issues for the body.
Yes, this was one of my questions, that in this world where Gen Zs are typically inclined to depression, anxiety, it has become a common term.
Yes.
And like how Tibetan medicine can help that, it was one of my questions. So you have rightly answered.
Yes.
Also, can you you want to say something about how Gen Zs or this kind of uh,
Yeah, actually, that's why, when we do medical tour to other countries also, especially the Western world, everything materialistically very much advanced. But still, deep inside of every individuals, there are a lot of kind of problems like loneliness,
yes, yes,
kind of anxiety, depression. All this, we don't have actually like proper medication.
okay,
I don't mean like particularly from biomedical science, but if unless we go back to the traditional systems, it's really very difficult to get, because we in modern science we rarely talk about these energies.
okay, yeah.
So for lung disorder or vayu disorders, for that we have a very good kind of treatments. We have not only the medicines but some applications
Okay.
to apply for that. That mainly reduce, balance the three energies. So we get a very good result.
Okay. So as you talk about your medicines or the applications, like can you brief about what kind of, what are the things that you prefer giving to your patients?
In Tibetan medical science, traditional medical science, actually we have 4 different processes for the treatment. First is not medicine.
Okay.
First is your lifestyle, dietary, and then only comes medicine on third place.
Okay.
And the fourth place, therapy. So therapy, we have external, internal, whatever this comes,
Yeah.
So first thing is like who you are is what you eat, like that. So diet is very important. In Tibetan traditional medical system, we focus more on dietary and lifestyle. These two are the main factors which causes mental, physical problems.
Okay.
So when I say lifestyle, lifestyle is not only like what you wear in the winter season, what you wear in summer.
Yeah.
And see, lifestyle means it comes 3 parts also. Body, mind, speech.
Yeah.
So all these things are very important when we talk about the lifestyle. And the dietary is, nowadays you see everything is pesticide.
Yes.
Even we say, don't eat outside, eat homemade. But homemade also comes from the market.
The fertilizers.
Yeah.
Yeah, pesticides.
So yeah.
Yeah, right. So also you have mentioned like you go internationally out of India as well for the relief things, So like talking about your journey, how did you start in Guwahati, or how did you incline towards the Tibetan medicine?
In Guwahati?
Yeah.
Guwahati, actually there's a story, means like, we doctors from our institute, we post to different places in India. We have different, like more than 50 or 60 plus branch clinics.
Okay.
So we post to different states. We have, so in Guwahati, I was shocked that we don't have even single branch clinic in Assam as a whole.
Okay.
That I noticed 2 years back. So me and my colleague Kandela, we just actually it was a plan of our institute to set a clinic here. So whatever 2 years back in 2023, we could set up this in Guwahati.
In Guwahati.
Yeah.
So since then, what kind of changes have you seen in this clinic, or like how patients have, perceived this clinic?
Initially, actually, we do medical camp here in Patam Bazaar. And later, so we could set up here. And then later, I noticed that the first time, at the very initial, it's, there's not much awareness also.
Yes.
But all patients, they knows only. So later now, see, like, I have patients from Bhutan, Samdra Zongar, and also from Manipur, also from Kokraja and Tezpur. Yeah.
So as you said, it was difficult initially.
Yeah,
So
initially difficult means like, the people have no awareness about this medicine.
Yes.
So that's why.
Yeah. So like still now, people are not aware of Tibetan
Yes,
medicine
yeah.
in Guwahati. So how would you like tell people or make aware people about the Tibetan medicine?
Actually, for that, thank you for coming here. So this
Yeah.
is also a very important media,
Yeah.
actually. But our principle is like not like just doing things in social media too much, because our very starting of our institute in any states, is like first we go just set up, and suppose you came today as a patient, so you got some problem, and we give some treatment, you got cure, then you share your benefits to your word of mouth,
Yes.
to your family, friends, and they comes.
That's how.
That's how it spreads.
It spreads, right. So, like also that how we have mentioned, like in modern hospitals, machine scans, these are in prevail right now.
Yes.
So, where does Tibetan medicine stand in this modern medical world, or like, do you think it can co-work together?
That's very good question actually, and I also really believe in the integration. It's very important. Integration doesn't mean like okay, I'm practicing Tibetan medicine and now I'm going to practice biomedical science. Not like that, but see, Tibetan medicine and biomedical science, there's 100% like a different approach, a different dynastic method,
Yeah.
But still Tibetan medicine goes along with, like parallel with 21st century.
Okay.
Because Tibetan medicine focus more on like what I've experienced, like more on holistic kind of treatment.
Okay.
So suppose you have some condition and you came to me like for the skin condition. But our treatment focus is not only just to cure your skin. We try to give you
Understand
everything like metabolism issue, whatever the root cause, For that we give the treatment, and then your whatever particular disorders, that also goes away.
Okay.
So that's why it is really very, I think, effective as well as has a good result even nowadays.
So suppose if one of your patient is undergoing through the allopathic treatment or the modern science.
Yes.
So is there any problem where Tibetan medicine can work together, or like
work together, no issues. Because my patients are like, actually my patients, they never come with the initial stage.
Okay.
Initially, if suppose there is someone detected with a major disease like cancer, first they go to allopathy. Of course they will go there, because while hearing that kind of term itself, they get frightened like that. But later what they do, they also do, like suppose cancer patient, they are doing chemo, radiation, whatever. Along with that, some patients, they are also taking my medicine.
Okay.
So for them, I also give like supporting medicine, which really supports, defends the side effects of the chemo, radiation, whatever this, and also it boosts the immunity.
Because the cells are damaged, right?
Cells are. So it's fast that chemo. Those who are on chemo, it destroys all the cells.
Yes.
It never differentiate your good cells and the cancer cells. So for them, we give Tibetan medicine as a supporting medicine.
Okay.
So it really helps for them to enhance their metabolism, immunity parameter, whatever. Yeah,
Overall,
yes.
it helps. Right?
And then it helps, like when we do the test, those who are having supporting medicine from us with the chemo and this thing, they have less kind of side effect.
Okay.
So it's
great.
going on, So some patients, they don't, they did everything, So there's some, on their interest, they sometimes they just want to take your medicine. This is, so we give medicines.
So like there are people who are solely relying on Tibetan medicine?
Yes.
Okay.
Yeah,
have you cured people like that, patients like that?
Yes. Actually, Tibetan medicine, and as a Tibetan medical doctor, we don't have like a specialist.
Okay.
like ENT or oncologist, whatever. No, Tibetan medical doctor means he has to try to treat for any kind of diseases.
Okay.
The patients come with any kind of issues, we try to give medication. So for me, example, like actually we have to do like that, but I'm more keen or interested in diabetics.
Okay.
So we have a very good result. Even when you have record like this thing, some has a very HbA1c is a test of diabetes, So this high percentage they comes with the report, So there's very good result. But they have to take a little bit long period of time.
Okay. So like the duration has to be a little long.
Yes, yes.
Tibetan medicine takes time to cure. That's
Yeah,
what you're
takes
saying.
time to cure means, there is some misunderstanding for this also.
Yeah.
Because, if you have a chronic condition, yes, it takes time. Like diabetes and these things we know. And diabetes patients, they never come, as I said before, they never come initially, They come very late, And so it takes time because Tibetan medicine really focuses on the root cause, To heal the root cause, it also takes time,
Yeah.
But suppose I'm not agreeing, like, Tibetan medicine takes time. Because, if you, suppose you got cold and cough, you take 1 week medicine and you will get cured.
Yeah.
Yeah.
Right,
So
right.
it's depend on the condition. Not
Also
like,
the
it's a herbal medicine, it takes time. No, it's not like that.
Also on the people when they are coming to
Yes,
take
yes.
your
But
consultation.
very important thing is like, the diet and lifestyle of the patients. For any condition, they comes here, but despite the medicine, we focus more on lifestyle and dietary. So I have noticed that, Indians, my friends, who are taking my medicine, they have quicker result,
Okay.
more effective what I saw. Because, when I say, okay, regarding this issue, don't take these things. And they never take, even their favorite things,
Okay.
they never take. So they get a very good result.
Yeah.
Even they can say like, oh doctor, this morning medicines is very good for my this things. When I eat this, these things happens. This is like that.
Yeah.
Yeah.
So it's not just about the medicine, it's how you take it, how you
Yes,
understand
yes,
it, right? So also at Men-Tsee-Khang clinics, including here in Guwahati, patients often say that medicines feel like food than drugs. So like, can you explain how these medicines are made?
That's really very true. Because, I myself have experienced how we make these herbal medicines, how we compound these medicines, and we also where we collect these medicines, high mountains and all these things. So these are all actually herbs only. So I sometimes jokingly say, you feel like you are taking this sabji, vegetables.
Yeah.
Really, no? So so that's why our medicine usually you have to take with lukewarm water.
Okay.
Because it's made of herbs. To digest well, you have to take with lukewarm water. It's better.
Okay, to get better results.
Yes.
Yeah. So also, like you said, it's from mountains, the herbals, right? The herbs and all.
Yes.
So when we think about Tibetan medicine, we often we say that it's maybe from mountains or prayers, monasteries. So that stereotype or that, how do you want to break it for Tibetan medicine?
Yeah, many those who don't have like background of the Tibetan medicine, they may think like it's a traditional something like prayer and these things. Somebody has to did some magical things or something like that. Really,
exactly.
it's not like that. Also, it's really very much scientific. Really, very much scientific. Nowadays, even in our main institute, we have not only the Tibetan medical department, but we have from the scientific point,
Okay.
we have quality experiment department, something like that, from the scientific department.
Oh.
So we are going parallel these days. Because even the herbs, ingredients which we put in the medicines, we have to first do the experiment from our side, Tibetan traditional department or doctor's side, and then we have to also do the experiment from the scientific point.
Okay.
Yeah.
So the herbs and everything are brought back from Tibet, or here you like,
No, we
what do you
also
do?
get from India.
India, right?
Yes, yes.
Okay, okay. So,
Yeah.
so after that you like test it, experiment
Yes,
it.
yes, yes.
So how? What is the process of that?
Process is quite
Technical.
uncomfortable,
Okay.
yeah,
Okay.
to tell here. But anyway, we have a kind of authentic process,
Yeah. Okay.
really.
Right. Okay. So as you said, at Men-Tsee-Khang,
Yeah.
and here also, like the things are very technologically and going parallelly. So like there is also increasing interest in Tibetan medicine right now
That's
on
very true.
research on traditional medicinal systems, right? So are there any current research or collaborations or studies involving Tibetan medicine at Men-Tsee-Khang?
Yes, yes. Not only current, but very long times back, we have this research department also. So from the research department, we are doing this research on particular kind of diseases also, with the aims, as far as my knowledge, with the aims doctors, as well as in Dharamsala, we have hospital, allopathy hospital, Gelek hospital. With them, there's some collaboration with lung TB,
Oh.
lung TB, tuberculosis. For that we have collaborations.
Okay, okay.
Yeah.
So are there any details about it, or like it is personal, it is
Yeah.
confidential?
Confidential means, so what I heard is like, with the collaboration, there's really very good result. They
Results.
said, yeah.
Okay. Yeah, yeah. So,
So good thing is, with allopathy medicine, we can take our medicine with the allopathy medicine, making 1 hour gaps.
oh, sorry, I didn't get
Making 1 hour gap.
1 hour gap.
Yeah.
Okay.
Suppose I'm sick, I can also take allopathy medicine as well as my medicine.
Okay.
Making 1 hour gap, So there's no issue.
There is no effect on
No
each
effect
and
on
the
it.
other one. Oh, okay. Right.
Yeah, that's like a very common question, everybody says, like, even my patients say, after taking this, is
Yeah,
there any
yeah,
reaction?
can be,
But
huh?
you don't have to think about it, because, Tibetan medicine is not like, kind of very strong, which easily react, like that. It's very mild, it's a compound is very, we think it very carefully for the compounded things, because, it not only like particular things. We compound the medicines thinking all about your metabolism, everything,
Yeah.
That's why we don't have like side effect as compared to other medicines.
Other medicines. Which is a great thing.
Yeah.
Because people are afraid of the side effects very quickly. So, also in your clinic is the signboard says free medicine. So, what about that?
Oh, that
Yeah.
actually, we did free medicine distribution 2 times.
Okay.
One was in Tezpur, one recently we did here.
Oh.
That's actually this year is 90th birthday of His Holiness the 14th Dalai Lama. So Men-Tsee-Khang actually was re-established by His Holiness the 14th Dalai Lama in India.
Yes, yes.
So this year also we are celebrating the 19th birthday as a year of compassion.
Okay.
So that's why in honor of this, His Holiness' birthday, we just did 2 times.
This initiative.
Yeah.
Wow,
Not only from here, but all the
all over India.
branch clinic in
yeah.
here. Yeah.
Okay. So we have got to know a lot about Tibetan medicine, how you cure patients. It was such a insightful conversation. Thank you so much for your time.
Thank you so much.
And we are glad that we could hear so much about it. But one last question is that how would you want to tell your patients to live the way you said the lifestyle is really important alongside the Tibetan medicine. So how would you want to encourage whoever is watching right now, for our viewers, that what lifestyle they should follow, and how Tibetan medicine can help any of the diseases they are suffering from?
Thank you so much. Regarding the lifestyle and the dietary, nowadays we get a lot of things in social media, no? But you have to know your body type. Actually, when I do officially kind of medical tour in other countries, they first come and then says like, oh, what's my body type? Actually, that's very good and very important question. Because, yeah, in Tibetan medicine, we say that we are made of 5 elements.
Yeah.
So, in one level, we say that we are same human being. Yes, that's true, but in another level, we are little bit different. Because combination of 5 elements is different. So, some people are thin, some people a little bit fatty, they think, no?
Yeah.
So, you should know your body type first. According to that, you have to go for the lifestyle and dietary. So, really, it's very important for you to go for the doctors for a consultation, like, what's my body type. General consultation, you can go for the Tibetan doctors and then you say, ask, like, what is my body type.
Yeah.
So, they will
Analyze it.
analyze it, and then they will tell you, like, you are a combination, you are predominant of kapha. Kapha means we call it peken. So it's a combination of earth and water elements.
Okay.
You are predominant of kapha, earth and water elements, but associated with wind energy, like that, So you got it, no?
Yeah.
Like you are predominant of kapha, that is earth and water elements, but associated with Vayu energy, means wind energy. So like that, according to that combination, then doctor will guide you to take like this. No? So see, kapha predominant patients, people, they are more like chubby, these things, no? For them, we have different lifestyle, different dietary plans. Yeah. That's very important actually. You should know your body type. Then according to that, you can go for lifestyle, dietary.
Yeah, and that's how we can prevent us from diseases.
Yes.
Right.
Yeah, Tibetan medicine actually is not, primary focus is not like medicine,
Curing
giving
disease.
medicine. Prevention of the diseases.
Yeah, right.
So these are line called, Minna Neda Nawa Sowata is a Tibetan line in Tibetan medical text. It says that, prevention, more focus on prevention of the diseases. Then after you get sick, then we have to go for the treatment like that. But it more focus on prevention.
Prevention.
So prevention is when we talk about the prevention, we have to focus more on diet and lifestyle. For diet and lifestyle to focus, you should know your body type. This is very important.
Yeah.
Actually, in modern science, you say you go for the skin problem and they check your skin type and these things. Like that, body type is very important. Yeah.
Right. Thank you so much. It was really insightful. That brings us to a conclusion that it's not just about herbs or monasteries, prayers. It's about the personal healing, the root cause. Basically. So thank you so much for this conversation.
Thank you so much.
That's it for the conversation. For more, please keep watching Northeast Now.